So here's the first image for the anterior cuff, the supraspinatus tendon with the probe in transverse or short axis probe orientation. So right shoulder that we're visualizing here on the slide. The patient is in the modified CRAS. The palm is facing forward, the elbow up as high as they can tolerate for us. Short axis probe parallel with the floor. And that's a key word to remember, parallel with the floor. Anatomically, because of patient positioning that we see here, the supraspinatus tendon that's highlighted in green is not back here under the acromion. When we place him in the modified CRAS, supraspinatus comes forward towards my probe that is in short axis parallel with the floor. That means we don't think that the supraspinatus is still hiding under the acromion and try to aim the ultrasound beam up under the acromion to see it. There's no need to do that. The probe needs to come in flat, parallel with the floor to get this image. So here's the ultrasound image that we see on the far right. And again, the interface identification always comes into play. Nice round convexity of the humeral cortex. We call this the tire on the rim view. So the humeral cortex is the rim of the tire. So first find the rim and then put the tire on the rim. So humeral cortex, hyaline cartilage, bright fibrous echotexture of the supraspinatus tendon. Remember, the normal bursa is a potential space. So if it's normal, we really shouldn't see it very well. But here we see this linear, small anechoic cleft where we could accumulate fluid in the bursa. This is the combined interface of peribursal fat and deltoid fascia, the bands and bundles of the deltoid, subcu fat, and skin. So this is a very important image, but it's really quite easy to perform. Tire on the rim, humeral cortex, hyaline cartilage, supraspinatus tendon, potential space for the bursa, peribursal fat, deltoid, and skin. So here's the image that's outlined for you again. Lateral, medial, humeral cortex, hyaline cartilage where the red margin is. In between is supraspinatus tendon. Here's the bursal interface, and there's the deltoid. Okay, so with regard to adding a measurement to the grayscale findings on the supraspinatus tendon, at the apex of the humeral rim, the value as a good average is 6 millimeters. Now when you place your cursors to do this measurement, be sure to not include the bursal interface or the cartilage interface as part of your measurement. So that's why the interface identification, the interpretation algorithm continues to be very important. So if we do this measurement and we have a measurement that comes back less than 6 millimeters, it is indicative of rate of supraspinatus thinning or degenerative changes or volume loss. Now that's all relative to and referring to changes with chronic rotator cuff disease. If you have a measurement greater than 6 millimeters, edema, or something that we're going to be discussing as increased cellularity. Increased cellularity is one of the 3 criteria that we use to use ultrasound to evaluate something that is very, very common in evaluating tendons, and that is tendinosis. You probably will never, in your clinical practice, see an active tendinitis.